Hi, I'm Sandy. I'm a mental health support worker for the Migrant Worker Community Program. Today, we will be talking about substance abuse, focusing on marijuana. Thank you so much for joining us. This project is funded by the Canadian Mental Health Association. All of our social media will be linked below, so make sure to check that out. Let's begin. Today, we will be talking about cannabis, also known as marijuana, warnings about using medical cannabis, risk for use with children, adolescents, and young adults, risk of lung damage from vaping, risk for use by persons with serious heart or liver disease. A guide to cannabis for older adults. What are the health risks for using cannabis? Can I use cannabis if I'm taking medications? Resources. The side effects of using medical cannabis are mild to moderate in severity and usually resolve quickly, but occasionally severe side effects occur. Existing studies of medical cannabis suggest symptom relief can vary from patient to patient. The warnings about using medical cannabis side effects are most common: dizziness, fatigue, dry mouth, lightheadedness, drowsiness, and nausea. Cannabis, also known as marijuana, is commonly called marijuana, pot, or weed. It is a product made from the cannabis plant. It is often used for non-medical purposes because of its intoxicating effects or the high it produces. People often use the words cannabis and marijuana. The word cannabis refers to all products derived from the plant Cannabis sativa. The cannabis plant contains about 540 chemical substances. Now that we have discussed medical cannabis, we will outline the risk for use by children, adolescents, and young adults. There is evidence that recreational use of cannabis or marijuana during the active period of brain development through young adulthood can lead to cognitive impairment. It is important to tell the healthcare professionals about the medical cannabis you are using. Medical cannabis can interfere with other drugs you are taking. Blood levels of other medications might need to be checked, and doses of the medications might need to be adjusted. Risks of lung damage from vaping. Healthcare professionals report severe lung injury potentially related to vaping and e-cigarette use among teens and adults. Health officials cannot guarantee the safety of any vaping products. People who vape and experience signs of respiratory illness should seek medical care. Do not use medical marijuana or use with great caution if you have serious heart or liver disease. There is some evidence that use of medical marijuana could cause heart attacks in patients known to have serious heart disease. Serious liver disease could cause problems with how the body metabolizes cannabis. However, for most health conditions, more research is still needed to determine whether it is effective. Cannabis contains over 100 chemical compounds called cannabinoids. The two best known cannabinoids are tetrahydrocannabinol, THC, which is the primary psychoactive component of cannabis. It is the ingredient in cannabis that produces the high. Research suggests that THC might have some medical benefits for certain health conditions. Cannabidiol, CBD, does not produce a high, but can cause drowsiness. Scientists are also studying CBD for its medical applications. However, for most health conditions, more research is still needed to determine whether it is effective. What are the health risks of using cannabis? Daily or near-daily cannabis use can worsen anxiety and depression, affect your memory, concentration, and ability to make decisions. Cannabis, when smoked regularly, can lead to sore throat, hoarse voice, coughing, wheezing, tightness of chest, and chronic bronchitis. Can I use cannabis if I'm taking medication? Cannabis can interact with your medication and affect your medications and affect your health. Medications that can interact with cannabis include pain medications, heart medications and blood thinners, sleeping pills, antidepressants and anti-anxiety medications, allergy, cold and flu medications, antibiotic and antifungal medications, heartburn medications, anti-seizure medications, drugs to treat HIV, AIDS, and ADHD medications. Please do not hesitate to familiarize yourself with resources for your well-being. We offer free mental health support, and you can reach us at 519-992-16 We also offer the Canadian Mental Health Association Workplace Outreach. We also have access to free professional mental health counseling support by calling 1-866-267-6255. It's designed to help connect Ontario farmers with tailored mental health support offered by licensed professionals, available 24 hours a day, 7 days a week, and 365 days a year. Thank you for your attention. Feel free to send us your questions and or comments regarding this topic on Facebook.